Um, Good evening, everyone. My name's Tim. I'm a family doctor. I've been a family doctor in Southampton, UK for 36 years. I'm going to give you a run through, just tell you what about compassion without burnout, and we'll be sampling little bits of it so you can see what it feels like. So, compassion without burnout. This started several years ago, and it started with the. Oh, am I able to advance slides?
You should have total control, Tim.
I should have home control, shouldn't I?
Yeah.
For some reason
If
it's
you
not
can't, I
there.
can run it for you.
Well, just give it a moment. It was working earlier. Perfect. Okay, so this started several years ago on the realization that a lot, particularly junior doctors, were except in the UK, were particularly stressed and some were burnt out. And it was a course aimed really to equip junior doctors to cope, but also to provide compassionate care. So these are the aims that you try to cover in a compassion without burnout session. I'd like to particularly look at the last one to share about these. So this would be a lot of small group work in a confidential environment where people could share. So who's it for? I mean, so as currently done, it's been run for healthcare professionals, healthcare students. There are pros and cons of how whether you do it in a multidisciplinary way or not. There's a lot of advantages, obviously, in multidisciplinary, but it does make it a bit harder to focus on the needs of individual groups. So I think it swings and roundabouts. About a year ago, I did it with a hospice in Devon, and there were loads of different people. One of the criticisms of the course came from the non-healthcare qualified carers for whom it was for, thinking it was a little bit too orientated to people with a healthcare, with nurses or doctors or OTs. So it's got to be you've got to be careful. You've got to gear the questions, the cases, and even the images you use so that people feel included. It could be adapted for other groups, such as I've got a friend who's did it for teachers. Clearly, if you're going to do that, you've got to run it alongside someone who knows more about the profession than you do, so that you can make it relevant. It was relabeled Compassion Under Pressure about a year or so ago because it was being piloted for a medical school, and it felt it was a more positive, zingy title, particularly for junior doctors, than Compassion Without Burnout. But it's a similar course. So this is what you'd typically cover in a full Compassion Without Burnout session. Typically, I like about 90 minutes to give time to cover all of these and to keep it very interactive in the way that Dave has described. I've put in bold the areas that I'm going to be covering in the next 25 minutes or so, which should reflect maybe just a little bit under a third of the course. So we won't be looking at stress and what makes you stressed and what you can do about it. We won't be looking about the causes of burnout, the symptoms of burnout, where you can seek help. And we won't be looking at the evidence base around why practice compassionate medicine. And apart from a very brief look, we won't be looking at a biblical perspective. It is usually delivered to a lay audience. It's not specifically a Christian course, but it can be adapted specifically for a Christian course. And clearly, it's important whether you're a Christian or not to provide compassionate care and to avoid burnout. So, first thing to consider, what is compassion? Normally at this stage, you had more time, I'd be asking people within the audience to come up with definitions. With the interest of time, I will come up with one myself. We will get interactive in the next few minutes. So there's been a massive amount of literature on the topic of compassion, often rather confused with the topic of empathy, which are. So what is compassion? Clearly, it's got to involve someone who's suffering, your patient who is stressed, who needs help, not just an ordinary happy person. This compassion's really not necessary if everything's going well. So there's empathy, and we'll talk about what's empathy. Also, there's a response. So those are the three things. You've got to have the need, you've got to have the empathy, but you've also got to have a response. Just feeling compassionate, maybe compassion, but that's not really what we're talking about. taking this definition a bit further, you've got three elements. You've got the first one is the understanding the person's suffering, understanding or making an attempt to understand. And that's the empathy bit of it. But the second bit is being prepared to help. There's got to be a response there. It's not enough just to feel someone's suffering to understand them. You've got to be prepared to make a response in order to help them. The third bit, in order to find a solution, I have to say I will challenge that a bit, because quite often compassion is needed where there is no solution. Actually, just standing alongside someone, being prepared to show that you care, or as Jesus said to his disciples, watch with me, what's needed. So I would challenge the solution bit, because sometimes it's not there, but compassion is just as important, sometimes at its most important. So, what helps make you more compassionate, and what makes you less compassionate? So, what I'd like to do in a moment is for you to just turn to the person next to you for 2 minutes. Just to usually these two things go together. The things that make you more compassionate are almost the opposites of the things that make you less compassionate. I'd like you to identify in your pairs the things that make you more or less compassionate, and then we'll get a little bit of feedback. So I'll give you 2 minutes to talk to the person next to you from now. Lovely. Well, that's a great list. Thank you very much. So what happens? So when you've got to exhibit compassion and you're feeling tired, you're feeling overworked, you're feeling emotional, you just had an argument with your wife, you're with a patient who's not very lovable, who's been unreasonable to you, who triggers something in you, because you feel judgmental. How do we manage to do this? Now, for a lot of people, this, what I'm about to say, is going to be very obvious, and so forgive me. This slide really came in response to particularly some medical students or early doctors saying, how can we do this, particularly when we're short of time? So just here's a few, what will hopefully be fairly obvious tips, but I hope that sometimes we need reminding of these things. So what can we do? We can touch the patient. How do we, when we're not feeling compassionate, we can use their name, Mr. Jones or George. We can use eye contact. We can smile, and we can smile even when there's a mask there. Patients can see us smiling behind our masks. Just that pause, that brief pause when someone has said something to you, those few seconds say, I've taken this in. You can acknowledge what the patient has said to you. You can make a personal reaction. That sounds really hard. You know, I can't imagine coping with all of that, Mr. James. You can give patients praise. You can give them encouragement, and you can offer help to follow through. Let's go back a slide. So all of these things that we can actually sometimes do very quickly, and it's a way of showing compassion when it's feeling difficult to show compassion. And one could discuss, I'm sure, many more things as well. So moving on to the next section of resilience. What is resilience? Well, here is of course, we are in the UK, so we will use the Oxford Dictionary if you don't mind. So there's two things here. There's the capacity to recover quickly from difficulties, toughness, and that's in a person or an organisation, which is related to this a more physical thing of a substance being of a bit of metal or something being resilient, being elastic, but being able to spring back into shape. And that's sort of what resilience is about. It's about you've got all the knocks of life, of work, and yet somehow you've got to keep going. How do we gather in resilience? How do we become resilient? This has been hugely studied. So I'm just going to look at one particular study. This, we would, in Compassion Without Burnout, we'd have talked about burnout, what makes people burn out, particularly what makes doctors burn out, particularly, for example, what are the sort of doctor characteristics, the superhero mentality, the Lone Ranger mentality, the perfectionist, that makes us more liable to burnout, as well as obviously the things that are going on in our life, our work environment. Well, what is it about us that makes us resilient? So this actually took the idea that if 20% of physicians are affected by burnout, what about the 80%? Why are they not affected by burnout? And they identified 5 characteristics of physicians who do not get burnout. And here they are. First is connection. So this is being connected with other people, having a support group, whether that's support at home, or that's support in friends, or whether that's support at work, is connectedness. The second is reflection. It's being prepared to reflect on things which are going on in life, but particularly at work, things that go well, things that go less well, and what do you learn? Limitations, knowing your limitations, knowing that, and this can be so difficult for the superhero doctor, for the Lone Ranger doctor, for the perfectionist doctor, knowing the limitations of your work and life. Being prepared to take time out, giving yourself a break, whether those breaks within a morning, whether those breaks within the week, within the day, within the year. And then finally, it appeared that people who had a spirituality were protected against burnout and were more resilient people. So this is a great list, isn't it? But there's a problem with the whole resilience thing. Does resilience, is this just one more competency that we must achieve? Putting it the other way around, or is this a failure if we don't achieve it? So resilience can, to an extent, be weaponized. It can be used, junior doctors are told they should be resilient. They're given resilient classes. They're said, well, you must take a break, but we haven't, please give us time to take a break in our working life. But from a personal point of view, the doctor who feels that they are not resilient then feels a complete failure, and it just adds to their problems. So I think we need to look at resilience in other ways. Chris Johnston was a doctor who, by his own admission, burnt out and then pulled himself together with help, and actually spent quite a lot of his subsequent career helping prevent other healthcare professionals from burning out. And what he says is this about resilience. It says that we have been created with weakness that penetrates to the core of our being. We can go 2 ways. We can be tempted to respond by just giving an area of confidence and strength. But Chris says greater strength may, however, begin with our acceptance of our weakness. So how do we manage this weakness? I'd like to thank Louise Uni, a prime colleague in the UK, who's helped my thinking on this. And she comes up with 3 S's. We always have to do these things. First is self-awareness, being aware of our limitations, being aware of our weakness. The second is seeking help. And the third is solidarity. Now, what I mean by solidarity is being prepared to have not just to seek help, but to give help as well in the work environment. So what might solidarity look like in your workplace? How are you? Now, there's how are you, and there's responding to how are you. It can become a very bland question for which there is only one answer, fine. So it's got to be asked in a way with space and actually looking at the person giving the reply. And when people do say they're okay, and being prepared to challenge this. Now, this is the thing that we're very used to doing as doctors. Maybe we're slightly less good at doing it with our colleagues. Share your own vulnerability. There's nothing that's going to make a colleague share their vulnerability if you do it first. Just say, I'm just finding this really tough. I've really had this tough experience. We'll encourage your colleagues to do the same. Small acts of kindness, whether it's just, can I make a cup of coffee for you? Or can I do this little bit of work for you? Neil Greenberg is a psychiatrist who comes from the armed forces and knows a lot about post-traumatic stress disorder. And in the light of COVID, wrote a lot of stuff about burnout and stress within healthcare workers. If you've got the time and listening to podcasts is your thing, I would really encourage you to listen to this. It's really interesting on how to tackle post-traumatic stress disorder in the NHS, National Health Service, or your healthcare. And one comment which jumped out is when talking to a colleague, give them a damn good listening to. In other words, spend some time listening to what's going on. So, I'd just like to wrap up before just giving you a few minutes to share amongst yourselves about this, a biblical perspective. This is a very well-known passage. This followed by Paul's thorn in his flesh. He pleaded with God on 3 occasions to relieve him of whatever this thorn in his flesh was that was weakening him. And God replied, "My grace is sufficient for you. My power is made perfect in weakness." And I think for those of us who are Christians, I certainly find this a really helpful passage when I am feeling weak, when I've blown it for whatever reason. And hopefully for people with a Christian perspective, this can be really helpful. So I want to give you a few minutes before we wrap up in your pairs, or threes if that's what you're in, to discuss for a few minutes, for 3 or 4 minutes, these 2 questions. How can weakness become a source of strength? Which of those acts of solidarity, I'll might flick back to that slide in a minute or two once you get going if you want to have a look at that, might you do in your workplace? Okay, well, I think the sort of time is up. So I think you probably would like a break now. But maybe you could continue these discussions. If you've got any questions, this might be easiest. I can just stay around during the break if anyone would like to just come up to the screen and have a word with me about compassion without burnout, compassion under pressure. The other person who might be a useful person to speak to is Andy, because I know Andy has run Compassion Without Burnout in a few cities, been in Pakistan, and I think in his current trip. So do ask him about how it's worked out. Really happy to sort of share slides, to spend some time with you if you'd like to see ask how you could apply this in your setting.